I'm Dr. Jeremy Bowen, and this is my partner, Kirk Opdahl. Our office is in Independence, Missouri. Found some great results right off the bat. Being in dental school, we're brought up on chlorhexidine being a gold standard. But this is a product that actually integrates with the saliva. And by integrating with saliva, that's no longer, in that crevicular fluid, that's no longer our enemy, blocking the action that's going in. When a patient comes in, they'll take a swish of the product for about 30 seconds and rinse with that. If we can reduce bacteria before we ever work on the patient, that's a good thing. Before we ever do any cleaning, we'll use the debriding serum, which comes in a syringe. In the syringe, it comes with 2 cc's. For the entire treatment of that scaling and root planing patient, we estimate that it'll be about a half a cc per quadrant. So in that one syringe is enough for the entire mouth if we were to do that. Let's put the gel down around the gums and allow that to kind of work in. And one thing that we found is when this gel is expressed into the sulcus, you'll notice that there is a lot of bubbling that happens. And that's the reaction that's occurring to help remove debris up out of it. And when that's done, several times in between, we will go in and put a little bit more gel in. And what you'll notice is by the end of the treatment, the gel isn't as effervescent or bubbling as much as it has been. Because there's a lot of research that shows through mechanical removal alone, you don't get the best results. And you got to have some other tools in your tool belt. And after using hand instruments, ultrasonics, I thought I had done really good. I would express some gel down into those deeper pockets and still notice that there was a lot of bad coming out. And the patient leaves with is the rinse, which has the same key ingredients in it. So we instruct the patients to rinse at least 2 times a day. And then there's also the gel pen, which has the same debriding gel that's in it, but it's in an easy to apply use for at home. And the one thing that I've noticed, we're pulling, we're stretching on the gums when we're working on them, and afterwards they don't complain of as much post-op sensitivity.
Since patients' gums have been feeling much better, is that they actually haven't had the need to take Motrin or any type of NSAID or anything after their periodontal treatment.
When the patient goes through that and they're able to come back to you and say, hey, that was a great experience, as best as it could be, that's very eye-opening to us and telling us that this is something that's doing something different that we're not used to seeing. And that's one of the main reasons that we want it, and the patients are referring their friends and family in to see us, because we're doing dentistry in a pain-free manner that's getting the results that we want.
The neat thing about this case is that there was actually 2 implants even placed. There was upper first molar was removed. Along with that, an implant was placed there, and then an incision was made to the anterior, and there was also an implant placed in the second bicuspid area. And this is a great picture. You actually see the cover screw showing, which is common with, especially when you have tissue that's trying to granulate over the socket.
And it was immediately placed.
It was immediately placed, yeah. So this next picture here is 1 month post-op. One of the neat things that I want to bring out here, besides such a great result, but the patient, her tissue actually grew over the cover screw, which it's really hard to have tissue grow over a cover screw because it doesn't attach to the metal. And not only did that happen, but you see a lack of inflammation there. We had complete healing, and if you were to prescribe a better healing or a better end result, you couldn't do that.
And I think this patient too was one that was worried about pain, and I don't remember a lot of reports of it.
There was absolutely none with her.
This next picture is mouth trauma. So there was a lot of bone recontouring. We did bone grafting procedure that day and placed, multiple sutures into the area. The picture here that you see 2 weeks post-op, using the rinse and the debriding gel. He actually carried the rinse with him everywhere he went because it just felt so good to his gums and made him feel a whole lot better. We used a class 2 narcotic and we used ibuprofen, but he reported back 2 weeks later that he hadn't needed very many of those at all.
This patient came in because he had really severe periodontal disease, so the amount of bacteria in his mouth was pretty high. The other thing is his tissues were really red.
Right.
Just a really poor case to begin with.
So here's a 64-year-old that, probably had a couple underlying health conditions.
So what we did is we had him rinse with the mouth rinse. We did the extractions, and then we actually used the gel and had him use the rinses. You can see here, though, after 6 days, he came back in. So we just wanted to check to see his healing, and we thought it looked tremendous. No inflammation there. Almost complete healing with all closures over all of those extraction sites.